Thanks for joining us on Oral Surgery Insights. I'm Dr. Russ Lieblick, and Dr. Brandon Rehrer is with me again. Brandon, today we're addressing a set of conditions that can cause significant discomfort and affect the daily lives of many individuals. Temporomandibular joint disorders, often referred to as TMJ or TMD.
This is certainly a prevalent and often complex area of maxillofacial health, Russ. The temporomandibular joint, being one of the most frequently used joints in the body, can be susceptible to a variety of issues. Understanding these disorders, their causes, and the spectrum of treatments, ranging from conservative management to, in specific cases, oral surgery, is crucial for patients seeking relief.
Absolutely. Many people experience symptoms like jaw pain, clicking, or difficulty opening their mouths, and they may not realize these are often linked to the TMJ. Our goal today is to shed light on these conditions and clarify when surgical intervention might become a necessary part of the treatment plan, emphasizing that it's typically considered after conservative approaches have been explored.
To begin, it's helpful to understand the anatomy we're discussing. The temporomandibular joint, or TMJ, is the complex articulation on each side of the head that connects the mandible, or lower jaw, to the temporal bone of the skull, located just in front of the ears. It's a unique joint, functioning as both a hinge and a sliding mechanism, facilitated by muscles, ligaments, and an articular disc within the joint space.
This intricate structure allows for the wide range of movements necessary for speaking, chewing, and yawning. TMJ disorders, or TMD, encompass a variety of conditions that cause pain and dysfunction in these jaw joints and the muscles that control their movement. The causes can be multifactorial and sometimes difficult to pinpoint precisely.
That's true. Potential contributing factors are numerous. For instance, bruxism, which is the chronic clenching or grinding of teeth, often occurring unconsciously during sleep, can place excessive strain on the TMJ and surrounding musculature, leading to inflammation and pain. Direct trauma to the jaw or joint, such as from an accident or a blow to the face, can also precipitate TMD symptoms.
Arthritic conditions like osteoarthritis or rheumatoid arthritis can affect the TMJ just as they affect other joints in the body, leading to degeneration of the joint surfaces and inflammation. Another common issue involves the articular disc, a small piece of cartilage that acts as a cushion within the joint. If this disc becomes displaced, damaged, or perforated, it can cause clicking, popping, and painful or limited jaw movement, a condition often termed internal derangement.
Myofascial pain, stemming from muscle tension, trigger points, and spasms in the muscles of mastication, the chewing muscles, is also a very common component of TMD. This is often exacerbated by stress, which can lead to increased parafunctional habits like clenching. So it's often a combination of joint issues and muscle issues.
The symptoms experienced by patients with TMJ disorders can vary widely in nature and severity. Perhaps the most common complaint is pain or tenderness in the jaw joint area itself, in front of the ear, or in the muscles of the jaw, face, temples, or even extending to the neck and shoulders. This pain can range from a dull, persistent ache to sharp, acute episodes.
Audible joint noises during jaw movement are also very frequent. Clicking, popping, or a grating sensation known as crepitus. While some joint noises without pain might not require treatment, when accompanied by pain or functional limitation, they are certainly indicative of an underlying issue.
Difficulty with jaw function is another key symptom. This might manifest as a limited ability to open the mouth wide, a feeling of the jaw getting stuck or locked in an open or closed position, or deviation of the jaw to one side upon opening. These limitations can obviously interfere with eating, speaking, and other daily activities.
Headaches, often similar to tension headaches, are commonly associated with TMD, as are ear symptoms like earaches, ringing in the ears, tinnitus, or a feeling of fullness, even in the absence of any actual ear infection. The proximity of the TMJ to the ear structures can lead to these referred symptoms.
It's critically important for listeners to understand that the vast majority of TMJ disorders are managed successfully with conservative, non-surgical treatments. Surgery is very rarely the first line of defense and is typically reserved for a small percentage of cases where other approaches have not provided adequate relief or where there's a clear structural problem within the joint itself.
That's a vital point, Russ. Our initial approach almost always involves a thorough trial of conservative therapies. This often starts with patient education about the condition and self-care strategies, such as applying moist heat or cold packs to the affected area, eating a softer diet to reduce strain on the jaw, and avoiding activities that aggravate symptoms, like wide yawning, gum chewing, or consciously clenching.
Medications can also play a role in managing acute symptoms. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen, can help reduce pain and inflammation. In some cases, muscle relaxants might be prescribed for short-term use to alleviate muscle spasms, or other specific pain modulators might be considered depending on the nature of the pain.
Physical therapy is another cornerstone of conservative TMJ management. A physical therapist knowledgeable in TMD can guide patients through specific exercises to stretch and strengthen jaw muscles, improve posture, and increase the range of motion of the jaw. Modalities like ultrasound or transcutaneous electrical nerve stimulation, TENS, might also be employed.
Oral appliances, often called splints or night guards, are frequently recommended, particularly for patients with bruxism or internal derangements of the joint. These custom-fitted appliances are typically worn at night to help deprogram muscle hyperactivity, protect the teeth from grinding, and sometimes to help reposition the jaw into a more favorable position, reducing stress on the joint structures.
And because stress can significantly exacerbate TMD symptoms, stress management techniques, whether it's relaxation exercises, mindfulness practices, or other behavioral therapies, can be an important adjunctive component of a comprehensive treatment plan.
So, given this strong emphasis on conservative care, when does oral surgery actually become a consideration for treating TMJ disorders?
Surgical intervention is typically reserved for those cases where patients continue to experience significant, debilitating pain or functional limitation despite a comprehensive and well-managed course of non-surgical treatments. If conservative therapies have been diligently applied for a reasonable period, often several months, and haven't yielded sufficient improvement, then we might begin to consider surgical options if there's an identifiable structural issue within the joint that is amenable to surgical correction.
It's not just about the failure of conservative care, though. There also needs to be a clear indication of a specific problem within the joint itself that surgery can address. For example, if advanced imaging like an MRI confirms a persistently displaced articular disc that is causing painful locking and restricting movement, and this hasn't responded to other treatments, then surgical intervention to reposition or repair the disc might be discussed.
Correct. Other specific structural problems that might warrant surgical consideration include significant degenerative joint disease, like severe osteoarthritis with bony changes that impede function and cause pain, or ankylosis, which is a fusion of the joint components leading to complete loss of movement. Pathological conditions within the joint, such as tumors or significant cysts, though rare, would also necessitate surgical intervention. Certain types of traumatic injuries to the TMJ that result in fractures or significant internal derangement might also require primary surgical management.
The types of surgical procedures for TMJ disorders range from minimally invasive techniques to more complex open joint surgeries. Arthrocentesis, for example, is a minimally invasive procedure that involves irrigating the joint space with sterile fluids to wash out inflammatory mediators and sometimes to help free up a stuck disc. Arthroscopy allows us to directly visualize the inside of the joint with a small camera and perform procedures like removing adhesions or repositioning a disc through very small incisions.
For more advanced structural damage or degenerative conditions, open joint surgery, known as arthroplasty, might be required to repair, reshape, or even replace parts of the jaw joint. In the most severe cases of joint destruction or end-stage disease, total joint replacement with a custom fabricated prosthetic TMJ might be the only viable option to restore function and alleviate pain, similar to hip or knee replacements. But again, these major interventions are reserved for a very small subset of TMD patients with specific severe pathologies.
The diagnostic process for determining if surgery is appropriate is very thorough. It involves not just a detailed history and clinical examination, but also often advanced imaging.
Yes, while initial X-rays might provide some information about the bony components of the joint, magnetic resonance imaging, MRI, is often the gold standard for evaluating the soft tissue structures, particularly the position and condition of the articular disc. Cone beam CT, CBCT, can provide excellent detail of the bony anatomy and any degenerative changes. These imaging studies help us confirm a structural diagnosis and plan any potential surgical approach with precision.
It's also vital to manage patient expectations when discussing surgical options. While surgery can be very effective for specific well-diagnosed structural TMJ problems, it's not a panacea, and it carries its own set of potential risks and recovery considerations. A multidisciplinary approach often continues to be important, even if surgery is performed, with ongoing physical therapy or appliance use sometimes necessary to optimize long-term outcomes.
That collaborative aspect is key throughout the management of TMD, whether surgical or non-surgical. We often work with physical therapists, pain management specialists, neurologists, and the patient's general dentist to provide comprehensive care.
To summarize then, Brandon, TMJ disorders are a group of complex conditions affecting the jaw joint and associated muscles, with a variety of potential causes and a wide range of symptoms. The most important message for listeners is that the vast majority of these disorders can be effectively managed with conservative, non-surgical treatments.
Absolutely. Our approach always prioritizes these conservative measures first. Oral surgery is reserved for a small percentage of patients with persistent, debilitating symptoms that haven't responded to comprehensive, non-surgical care, or for those who have specific, identifiable structural problems within the joint itself that are amenable to surgical correction.
If individuals are experiencing persistent jaw pain, clicking, limited movement, or other symptoms we've discussed, a thorough evaluation by a dental professional and potentially an oral and maxillofacial surgeon is essential for accurate diagnosis and to explore the most appropriate treatment pathway. Thank you everyone for joining us on Oral Surgery Insights.
We appreciate your time and trust that this overview of TMJ disorders and the role of oral surgery has been informative and helpful.